Guys, my name is Dr. Mona Hardas. I'm a board certified OBGYN from Michigan. I'm a cosmetic gynecologist. I'm an author, and one of my passions is education. I like to empower women with knowledge about their health issues. So let's talk about Depo-Provera today. Depo-Provera Shot, which is a shot. Everybody talks about the shot for birth control. That's what is the Depo-Provera. It's been out there for years and years and years. People have been using it forever, but they are still concerned and worried about it because there is so much misinformation about this amazing birth control option. So what is Depo-Provera? Depo-Provera is a progesterone-only birth control option. That means it does not have estrogen, it just has progesterone. The progesterone in it is called medroxyprogesterone acetate, and it's 150 milligram of it. So what happens is that this is a shot we give you. It's an intramuscular shot. It can be given either in the arm or in your butt area, and one shot lasts for 3 months. That's what the Depo, that means it's a Depo, like a extra amount of a hormone, put it intramuscularly, and it's slowly released in your body, and that's how it works. So it's good for 3 months. That means you will be going to your gynecologist 4 times a year. That's it, 4 times a year. Get your shot done. You don't need anything else. It's very discreet. Nobody needs to know. You're just going to a doctor to get a shot. That's basically it, some medication, and it works out great. It's 99% effective. Yep, only 1% failure rate at all. So the Depo shot we like to give you right at the end of your menstrual cycle. So within 5 days of starting your cycle. So the first day of your cycle is the day you start bleeding, not spotting or brown discharge, actual bleeding. The day 5 on is when we give you the Depo shot. So when you start your cycle, you call your gynecologist, say I'm ready to get my Depo shot, come in day 5 and we give you, and you will be covered that month. You know, it will be effective that month. If it is more than 7 days though, then effectiveness of Depo for first few weeks will not be there, and we will ask you to use a alternative contraception option like a condoms or spermicidal gel or something to protect you at that time. So really important to start it right on time. Now what happens once you get your Depo shot? Then the hormone is slowly released in your body, right? So as your body is getting adjusted to it, it is likely, highly likely, I would say 50% or so, that you may have some irregular bleeding and spotting, right? So don't be alarmed. It is a part of this whole process of your body getting used to Depo shots, right? So irregular bleeding and spotting might be light, like a little brown discharge here and there, comes and goes, or it could be heavy as well. Don't panic. By the time you get your second shot, which is in 3 months, most likely the bleeding will be gone. And the good news is, after the second shot, most of the people don't get a menstrual cycle at all. Yeah, that's a bonus, right? You will not have to deal with the menstrual cycle as long as you're on Depo shot forever. So just hang in there for 3-4 months. Bleeding goes away. You come in every 3 months, 4 times a year, get your shot. Now the effectiveness of the Depo, because it's a Depo shot, it lasts for quite a few weeks even after the last dose. So concern is that if you are gonna be trying for a pregnancy, if that's something you are like interested in immediately, then Depo is not gonna be the good option for you. But if you are gonna postpone it for at least a year or so, then yeah, let's be on a Depo. Sit down with your gynecologist, decide when you are gonna try for pregnancy, and we can always stop the Depo shot and put you on an alternative hormone till you are ready to get pregnant. The side effects of Depo is what people worry about. As I told you, irregular bleeding and spotting is the commonest. Weight gain is seen in about 10% patient. Weight gain is more common with Depo-Provera than other medications, so watch out for that, and if it is a concern, then we can always change or talk about limiting the weight gain. It doesn't continue to happen, but for first 2 to 3 months you might see the difference. Depo is sometimes also associated with increased chances of depression kind of a symptom. So if you have an underlying depression or you are worried about that, maybe this is not gonna be the right choice for you, and we can always change it. Very few patients I have seen over the years have also complained about hair loss. I've seen it more common with Afro-American women, but I don't know why. But if that's a concern, obviously Depo is not going to be the right choice for you. Depo is a hormonal contraception, so remember, it is not going to prevent any sexually transmitted diseases. So when you are sexually active, for prevention of the STIs, not the pregnancy but STIs, you should be using alternative contraception like condoms along with it. You just had a baby, you know, with so much going on after the childbirth, there's so many things to do, and so one less thing to remember and worry about will be birth control. So although we say no sexual intercourse for 6 weeks till everything is healed up, you can still get your Depo shot right when you're leaving the hospital, so then you're gonna be covered. Breastfeeding, great option for breastfeeding. It's not contraindicated. It's not going to affect the amount or quality of the breast milk. So that is something easy. If you are if you're a teenager, then remembering the birth control is gonna be hard, Depo is a great choice. If you are in perimenopause, nearing menopause, you don't want to take excessive estrogen and the side effects associated with, Depo is gonna be a great option for you. So a lot of people it is indicated, some it may not be, like if you have underlying heart disease, if you have underlying clotting disorder, blood clot, high blood pressure, diabetes, all those medical conditions, if they are there, then you're gonna have to sit down with your gynecologist, your medical provider, and see if you are a right candidate for Depo shot or not. But if you have heard bad things about Depo-Provera, and if you are concerned, if you have any specific concern, please call me, call our office. We would love to sit down and talk to you whether this is the right choice or can we offer you something different.